The cervical region, or neck, sits between the cranium and the thoracic vertebrae. This region contains 7 vertebrae, 2 of which we have already discussed, C1, or the atlas, and C2, or the axis. The cervical spine sacrifices stability to provide us increased mobility. Thus, there's a wider range and variety of movements here than any other area in the spine. The cervical spine allows for 70 degrees of extension, 80 to 90 degrees of flexion, 70 to 90 degrees of rotation, and 20 to 45 degrees of lateral flexion. Cervical vertebrae 3 through cervical vertebrae 7 are considered typical. As you can see, with a typical cervical vertebrae, they have a small vertebral body due to the fact that they bear very little weight. They have a large triangular vertebral foramen due to the fact that the spinal cord is largest here and needs additional room. They have transverse processes bilaterally here, and within those processes have transverse foramina here, and through those foramina travel the vertebral arteries and veins. The vertebral arteries stem from the subclavian arteries and will ascend through the superior 6 cervical vertebrae. At the atlas, they'll loop around the lateral masses and ascend through the foramen magnum into the skull. Inevitably, they'll meet together, forming the basilar artery at the base of the pons. Appreciate that with cervical rotation greater than 50 degrees, you could kink the vertebral artery traveling through the contralateral foramina, and with 45 degrees of rotation, you can cause kinking on the ipsilateral side. This kinking could lead to vertigo, or a sense that the room is spinning, nausea, tinnitus, or ringing in the ears, drop attacks, visual disturbances, and in rare cases, stroke or death. These symptoms are due to oxygen and nutrient deprivation of the structures the vertebral artery supplies, for example, the brainstem. The superior articular processes of the cervical vertebrae face superiorly, posteriorly, and medially at a 45-degree oblique angle, while the inferior articular processes of the cervical vertebrae face inferiorly, anteriorly, and laterally at a 45-degree oblique angle. This readily allows for flexion and extension range of motion, but forces lateral flexion and rotation to occur to some degree together. This we refer to as a coupled motion. Additionally, the superior side of the cervical vertebral bodies have elevated borders laterally and posteriorly, with the inferior side of the bodies being the reciprocal. This again favors flexion and extension range of motion while limiting lateral flexion and rotation. Thank you very much for watching this video. I really hope that you enjoyed it.